Join us today as we get to the root of female hair loss. Hello and welcome to Health and Wellbeing. I'm Vicky Lech. Now, it's something that we normally associate with middle-aged men, but women's hair loss is more common than we all think. Despite female figures such as Gail Porter and The Voice's Tony Warner recently speaking openly about their hair loss, many affected women still feel unfeminine, embarrassed and even depressed. Joining me today to discuss the causes and the stigmas associated with women's hair loss are psychologist Corinne Sweet and one of the world's leading experts on hair loss, Dr. David H. Kingsley. And we're also joined by Birgit, who has herself suffered from hair loss. Welcome all of you to the show. Thank you for being here. Here's what's coming up. We discuss the many reasons why women may suffer from hair loss and the psychological impact it can have. We also hear about some of the social stigmas attached to the condition. And of course, all of your questions will be answered here live. As always, we are live today. So if you have any questions for Corinne, Dr. Kingsley or Birgit, please use the box on the screen and we'll do our best to tackle them over the course of the next 15 minutes or so. And if you are tweeting whilst watching the show, all you have to do is use the hashtag StudioTalkTV and we will try and give you a mention. So Dr. Kingsley, if I can start with you, This is more common than we realise amongst women.
Absolutely. Vicky, over 60% of women get hair loss at some time in their life, and as we speak, over 5 million UK women suffer from the condition.
And why do you think we don't really hear about it? Is it because people don't want to talk about it so much?
Yeah, I think that they're embarrassed by it. They're ashamed. In the study that we did, we showed that how it is affecting their quality of life. It affected their self-esteem. Women didn't go out. When they did go out, they were looking at everybody else's hair to compare and thought everybody was looking at their hair, and they became very depressed and very anxious.
So what are the types of things that causes hair loss? Is it the same for gents?
Actually they're similar, but there are a lot of different reasons why women lose their hair, and often it's a combination of these factors. The main factor, as with men, is genetics or hereditary, but there's also diet, not eating enough protein, maybe losing too much weight too quickly, stress, and hormones coming off the pill, thyroid issues, menopause.
So these aren't necessarily things that we can avoid, because although we can be slightly careful about having stressful lives, you know, now from time to time you are going to take on a job or a task that's going to be extra stressful.
Yes.
But you're not saying that's definitely going to cause hair loss. You're just saying it's one of those things.
No, it's not definitely going to cause it, but it might accelerate it. It might make the hair loss worse. But yeah, there are things you can do. If you can ascertain why you're losing your hair, and then work on it lifestyle-wise, stress reduction, maybe exercise or relaxation, improve your diet, making sure that you're eating properly, eating regularly, eating enough protein, which is what the hair's made out of. So there are a lot of things. Also cosmetically improve the hair. In the study that we did, women who cosmetically improved their hair with these natural trichology treatments felt so much better about themselves. And be proactive, go to the physician, find out the whys and treat them.
Absolutely. So it's being very aware about all areas of your life, what food you're eating, are you looking after yourself, de-stressing when you can de-stress.
Right.
Let's talk about this study in a little bit more detail before we get to you ladies, which we will do very soon. Tell us a bit about the quality of the life that the ladies were leading who suffered hair loss.
Well, as I was saying earlier, the study actually had two parts to it. We wanted to see how hair loss affected quality of life, and then we wanted to see, well, okay, it's affecting it. How are we going to improve that quality of life? So I mentioned before some of the self-esteem factors and the anxiety and depression. So what we did, we said, right, let's see what natural treatments we can do to help improve it, because it was a genetic hair loss we looked at, which is a long-term or chronic condition, and with no reliable cure. And with these type of conditions, women, we found, didn't want to go on prescription medicines or use harmful chemicals for like 20, 30, 40 years. So we put together this natural treatment just to improve the cosmetic factor of the hair, to see if that would help improve their quality of life. And sometimes something that simple actually made them feel a lot better.
I can imagine. Corinne, we're going to come to you in a second and talk about actually the psychological effect that your appearance, or certainly a change in your appearance, can have on a person. But before we do that, Birgit, let's talk about your experiences, because as a female, I can say pretty much all the time I'm thinking at some point in the day I'm going to be in front of this person, or I'm going for this interview and I need to look a certain way. But you are on the stage. So tell us a bit about your experiences.
I always had fine hair, you know, that is genetically given to me. Therefore, I couldn't do much about it. But I realized when I became a bit older, 10 years ago or something, very beginning 40s, when I pulled my hair back, for example, it shined through, you know, you could see a bit my scalp. I said, what's going on here? It's miles too early, you know. And especially on stage, you have a hairpiece, you get it in the back, and your own hair is used in the front. And I was uncomfortable, you know, and felt, my God, I don't want to finish up wearing a wig. And covered it up, had even extensions, was all not good, you know. It's only a kind of, yeah, and then you pull out the existing hair, comes out with poor hair, you know, is pulled out in the end totally. But therefore I took this product, if I can mention the name, this Nourkrin. I came across, first I was a bit irritated. I thought it's kind of expensive for the fact, you know, I didn't know it about, it's simply natural, but that again convinced me to give it a go, because it was a kind of organic approach. And but you didn't ask this, how it affected me. You want to know?
Yes, initially, because looking at you now, we've all said you've got beautiful hair and you are a stunning woman. But when you initially found out, or rather you realised that you did have fine hair and you were seeing those thinning patches, what did you feel? How did you feel? Certainly, something insecure,
and I mean, you couldn't do much at it at the moment, but it gradually happened. Then anyway, and I always had a very short style. Suited me, but I wanted longer hair. And now, I mean, for me, it's now a mane. You know, it's not for you. I know people with naturally gorgeous hair probably would think, oh, what she's on, she has a little hair here. But it is a big improvement for my previous condition. And therefore, I'm really behind this. And I could see it, and I recommended it to friends, colleagues, men, opera stars. They get, you know, they get this a bit back, and they rub the lotion into their scalp, and they see a regrowth, you know. And that is, therefore, I think it's not only women, it's men as well. Or it is.
Absolutely, but it is, Corinne, I would say, something that we discuss quite openly amongst men, and rightfully or wrongly. I mean, I joke around with my dad all the time about his little bald patch, and I probably shouldn't do it, but I mean, he's quite light-hearted about it. It's something that he is okay with. I would say the majority of women, however, wouldn't be okay with it, and it's probably quite distressing. So how does it, do you think, affect us psychologically?
I think for women it's absolutely devastating because, first of all, as you've said, it's a taboo subject. We're not supposed to lose our hair. Yes. It's all right for men and it's not all right for men, but we've become used to male pattern balding, as it's called. But for a woman, it's like a freak show. It's like a Victorian circus act. It's something that we used to go and pay to see the bearded woman and the bald woman, and I'm afraid it is something that has that stigma attached to it. And therefore what happens, there have been people in the news like Britney Spears when she took her hair off, or certain characters who then become ridiculed. And I think we're quite forgiving if somebody has got chemotherapy because they're ill. We might be quite forgiving, or if they have alopecia. like Gail Porter, but if you're simply, your hair is thinning, we take it as a sort of some kind of quality of character that's missing, as if we are not feminine enough. And I think the survey that's just been done by Nourkrin, it actually showed several things. That 45% of women said they dreaded losing their hair more than anything else, even more than putting on weight. It actually mattered more. Secondly, they felt less feminine. Thirdly, they felt less sexy. And I think one of the things that's, if you think about Wicked, the musical, in Wicked she has toss with her hair. And the reason is your hair is a secondary sexual characteristic. It's like other parts like breasts and bottom and all that kind of area. Your hair is what you flick and you look through and you twist it and you flirt with it, and it's what makes you feel female and feminine. And of course it says you're reproductive, you're ready for a male, and it is something that attracts men, because the studies done on attraction, the first thing men do is not look at the obvious areas, they look at the face and the hair, and then they look at the obvious areas. But the first place they look is up here. And if you're balding as a female, it will say, I'm not reproductive, I'm not ready for you. And therefore the man will look for somebody who's got more hair. So when women begin to lose their hair, it is very cruel. And it is actually that distresses women, because they feel they're losing their femininity, they're losing their identity. Now, in terms of the longer term impact, as Dr. Kingsley has said, some women get very anxious, get very depressed. What follows with that is agoraphobia, which is the phobia of not going out, hiding, and then even suicidal feelings. And I have actually seen clients who say, I don't want to live, because it's so obvious, your hair. There's only so many hats and scarves that you can wear all the time. And if you do want to go out, you will compare yourself to other people, other women. You'll be looking at women thinking, I'm taking a pair of scissors with me because she's got nice long hair. And then, of course, you're going to be thinking, do I want to wear a wig and a hairpiece and extensions? And it's almost taken as if your character is failing because your hair isn't looking good. So I think it's deeply devastating.
I mean, it's earth-shattering. When, as you're talking, you can see how it would naturally progress into that sort of earth-shattering...
I think people don't realise when they go to a physician, often they're sort of like not taken seriously, because a physician won't see that they'll say, well, it's not life-threatening, but it's life-altering, and that's really important.
Yeah,
and
absolutely.
the other thing is, as Dr. Kingsley has said, and also Birgit has said, that when you lose your hair, when you say it might be thyroidal or it might be having had a baby, when my hair fell out when I had a baby, and you know, it comes out in clumps, and you have a hairy pillow in the morning, and you think, oh my God, what's happened? But I think as you get older and your hair thins after the menopause, for women it's a fear of aging, and so when your hair thins earlier, you think, oh, I'm getting old, I'm no longer attractive, and that is very scary. That makes you feel low self-esteem, lack of confidence, and then that might make you think, I can't get a job anymore, I can't attract a man. And in a time when most of us are having multiple relationships, in other words, we have 1, 2, 3 husbands, partners, you know, and life is going on much longer than it used to go on, we want to be able to attract people in our 50s, our 60s, our 70s.
Well, absolutely. So let's leave part one on a positive note. Before we get anywhere near that, what advice would you give to people who perhaps are noticing that they might have some hair loss issues? What can they do? What's the first thing they should do?
It's very important to realise not all hair loss is permanent.
Yes.
A lot of hair loss conditions are temporary and will regrow. But they should find out, go to a specialist, go to their GP, make sure they take them seriously, find out all the whys, and then tick each box saying, okay, A, B, and C is causing the problem. We need to do D, E, and F to help counter that.
Absolutely. Birgit, how about you? Because you've lived this, so what would you say?
At first I cut out special dangers by hair treatments. For example, I never use straighteners because it wouldn't go for me anyway, but not too hot. You try to do this on top of everything else, and this helps a little bit, you know, not over bleaching, you know. And I looked around what is going on in Germany. We have a product called Priorin or something, but it had very little compared with the other product, much less from everything, you know. And I was glad that I could find this. And I took it for now 6 years, on and off. You know, in between, no, not so much, I think 5 years I'm doing now, 5 years. And take it, I mean, if it's for the rest of your life, it's an investment.
Absolutely.
But I think it should be prescribed. That's an idea. That's an idea.
We'll petition for that.
Yes, I mean.
So be good to the hair that you've got, I think is really quality advice. What about keeping those thoughts healthy and as positive as we can?
It's a very good point, because I think that for women, I work a lot with people who go into a downward spiral. Depression or anxiety leads you downwards into a downward spiral. And the minute you start saying to yourself, I can't go out, I can't have a date, I can't go for a job, I can't do this, I can't do that, you're letting it rule your life. So I would agree with Dr. Kingsley, find out your information, cut out the bad habits or the pollution or the bad diet, try and improve those things, and then think positively. And what you need to do is help yourself and don't give up.
I'd be proactive.
Yeah, brilliant.
Definitely.
Could a quick pick up on this femininity aspect, because that I was so aware of it. That is the main problem for me, you know, being a woman anyway, but that is associated with sexuality, with attractivity, with all these kind of things. And they say that if you dream, you must know this, losing your teeth, you think that your identity as a woman disappears, but also with hair. I think Freud had written something, and that is it, you know, that's your natural treasure.
Absolutely.
That's the only thing, you know.
Crowning glory.
Crowning glory, you say here in England.
But you have to think positively and take steps to do something about it.
Okay, great. And actually, we're going to take steps now to help all of you watching at home. You've kindly sent in your questions, so we're going to have a look at those next. Okay, we're back and you've been sending in your questions. Thank you very much. This one is from Nikki. Thanks, Nikki. Nikki says, I quite often add hair extensions to my hair to give it more body. Is this bad for my hair? Will it have a bad effect long term?
Long term, maybe. Short term, great. The trouble is, it makes the hair look so good initially that you don't really want to take them out, because then if you do, you know, who saw me with them in, and, you know, if you go see family or friends and you don't have them in anymore, are they noticing my hair loss even more now? So I do totally understand why you would want to use extensions or have them put in, but I think in the long term they cause a lot of breakage. They can sometimes cause a little bit of hair, pulling the hair out as well. So maybe if you start off with them, then cut down the numbers slowly, and then maybe as your hair is getting better naturally with maybe some treatments or something, that then you can phase them out, wean off it.
And
exactly.
I presume you're talking about the bonds, the ones that stay in, not the clip-in.
The clip-ons aren't so bad, but you're clipping them in, taking them out, clipping them in, taking them out. So sometimes you do get a little bit of breakage with it. Better, but, you know, it'd be nicer to.
So perhaps,
get the
Nikki,
hair
if
to
you
grow
have a
back
special
naturally.
occasion and whilst you're getting treatment elsewhere, you want to feel special, but maybe not every day, all day.
As a long term.
I mean, don't sleep in them, Nikki. That's what we're saying. This one is from Mary. Thank you very much, Mary. How often should I wash and style my hair if I'm suffering from hair loss? Now, I think that's an interesting one, because
very interesting.
I seem to lose a lot of hair every time I wash my hair. I know my other half would talk about our plug and the hair he finds in it every time I wash my hair. So what do you do?
Well, it's important to know when you lost a hair this morning, on average, that hair stopped growing in February, 3 months ago.
Wow.
So actually washing your hair today is going to make no difference to the amount that's coming out. And in fact, if you wash it less, it accumulates. So you actually see more coming out. My suggestion, because part of the study that we did was looking at the cosmetic appearance of the head. So if you shampoo it and dry it and style it, and you're looking in the mirror, you're feeling a lot better about yourself, do it.
Yeah.
Absolutely.
I think the confidence that you feel when your hair looks nice is better than if it's a bit lank and hair is falling out on your shirt and on your
I
collar.
think sometimes the next day now, where I have a bit improved hair, the next day my hair is better than actually the day when I washed it.
Oh,
I
really?
washed it.
Yes, so some
It
people actually
settles
find
down.
that. And
Yeah.
I'm not saying you have to wash it every day, but what I'm saying is don't be frightened to
Don't be
wash it as
frightened
often
to.
as you need
Yeah.
to.
In the past, I had to wash all the time because otherwise I wouldn't have no volume whatsoever. And now I try to, I have 2-3 days, and I'm okay. It is. I think if you treat it nicely, then you wouldn't damage. That is what you're saying.
Yes,
Yeah.
and I have a saying as well that you're washing your face every day, you're not removing your eyebrows and eyelashes. No, but it's true.
True,
So
yes.
you're not necessarily removing scalp hair that
Yes.
wouldn't necessarily be coming out.
And quite often, I know my mum has incredibly fine hair, and it would be impossible for her to leave her hair for a day because it really, like you were saying, it has no volume. It needs the styling. So.
That's right.
Good tips. Let's move on then. This one is from Lynn. Thanks, Lynn. She says, Corinne, my hair loss really gets me down. How can I stay positive? Any tips, please?
The first thing I would say is well done for talking about it now, because it's one of those things that's so stigmatised that we don't talk about it and we suffer in silence. And when you don't talk about it, it eats into you and makes it feel worse. So great for airing it now. I would get some help by talking to a pharmacist, talking to your doctor if your doctor is one of those people that you can talk to, talking to your friends. If you have a partner, tell your partner. Don't be frightened that your partner will leave you.
Yes.
And try and first of all get some sort of information about it and try and talk about it. If you get very depressed about it, I would see a counsellor, and you can look online for counsellors. If you go to something like the BACP, which is British Association of Counselling and Psychotherapy, go to a proper counsellor, don't just go to anybody. But there's no shame in it, and I think it's very important you do talk about it, if it's worrying you especially, because if you get more anxious when you don't talk about things.
You absolutely do, because it builds up into this big scary monster, so it's so important. And it can be anyone that you feel safe having that conversation with.
And you'll probably find other friends will say to you, oh, it's happened to me
Absolutely.
too. I thought it was just me. And in fact, that is the truth, that none of us are really alone with this, but it does make us feel very alone.
Yeah, absolutely. We have time for one more question. This is from Jessica. Thank you, Jessica. She says, I work in a very stressful environment and I've only just started noticing since my change of job that I'm losing my hair. Is this what's affecting my hair, she's saying?
Well, it's possible. Often with hair loss, as I said earlier, it could be a combination of factors. If it continues for more than maybe 4 or 6 weeks, I would suggest that she goes to see a specialist to find out are there any other reasons. But if it is just purely stress, I think it's important that she does some stress reduction, talking to someone, as we said, maybe exercising, relaxation, maybe having a bath instead of a shower, that type of thing, so that each evening maybe she just comes down a little bit, so she's not getting all those stress hormones going on consistently.
I mean, I meditate, and it's possible to meditate in 5 minutes actually.
Absolutely.
And change your brain waves, your alpha rhythms in your brain, and it changes your heart rate, because I think most of us are so stressed, we just have a drink or we have a cigarette or we just do something that's rushing. And of course it affects the whole of your body, including your hair.
It's an interesting point, because when my career was full on and I was singing every day somewhere, or everyday TV, it was really full on career, I had the problems with the hair. It started then.
Yeah.
It just occurred to me. And
Yes.
I haven't really thought about it.
And probably
And there
you
was
rushed,
no menopausal time. It was,
No. You probably rushed food.
yeah, everything
Yes,
rushed.
that's right,
everything.
because
It's
if you're under
rushing
stress, you're not
food.
eating
Yeah.
properly
I didn't
either.
sleep sometimes. I always could luckily sing, but I was burning at two ends, you know.
Yeah.
And
I think it's so difficult to spot it when you're in it. It's not until now, these years later, that you look back and say, actually, I was pushing myself too hard. So it's all about people being very aware of their day-to-day lives, what they're eating, how they're relaxing, and really what they're doing to de-stress after their busy days at work, because everyone's getting busier these days.
I think we've never lived such busy 24/7 existences, and the people under real duress, like students, like people commuting, are all eating on the run. And I would say try not to eat on the run. Try to give yourself 5 minutes with your phone turned off. All those things that you need to do just to be, and you won't be so sort of hair raised as a consequence.
Absolutely. Thank you so much to all three of you, but we are out of time. My thanks to Dr. Kingsley, Corinne Sweet and Birgit Beer for joining us. If you do want to find out more about female hair loss, go to the website nourkrin.co.uk. Thanks very much for watching. I'll see you next time. Bye-bye.